Osteomalacia is another interesting phenomenon, and when we observing a deficiency of vitamin D, that may lower the absorption of calcium from the gut. Osteomalacia can be translated such as softening of the bone. So softening of the bone is a deficiency of calcium. So osteomalacia will happen if we don't have enough vitamin D, as I said. So vitamin D, certainly we need it to facilitate the bone mineralization, which will give us structural integrity and hardness to the bone. So without appropriate mineralization, or with delayed mineralization, bone formation will not advance. So when we're having bone formation, recalling from A&P, bone will progress to osteoid formation, but calcification will not occur, and the result will be soft bone. So vitamin D deficiency in an adult may be secondary to low nutritional intake and or malabsorption problem. And this day and age in the United States, it's rather difficult to have low vitamin D intake, considering if the person that consumes milk and milk products, because everything is fortified with vitamin D. But it's still, there are people who are lactose intolerant, or for one or the other reason they avoid milk or milk products. At the same time, we all hear that ultraviolet radiation is certainly carcinogenic, so we do not have that benefit of sun rays to produce vitamin D. So this all results in osteomalacia. What will happen? So patient will have bone pain. At the same time, they may develop small fracture, like bone fracture, compression fracture. Even it can get to the point that the patient may have vertebral collapse and bone malformation. So bones that have weight-bearing growth will be affected the most. They will show some deformity, and those are the bones in the spine, vertebral bones, pelvic girdle, and bones in lower extremities. So patient will again have pain, bone fractures, vertebral problems, and malformation. Treatment will include the correction of deficiency of vitamin D, and patient may be required to consume significant amounts, approximately 200,000 international units weekly of vitamin D for month and a half, and then it may be followed by daily doses of vitamin D in the future. But it usually works. But on the other hand, if there is some damage already done, like the bowing of the bones, shortening, flattening, this will not help. This will not help to return to baseline. So what to do, what to advise to your patient, how to avoid this? Easy. Sunlight, again, controversial, and I will make a disclaimer, so please discuss with the patient the exposure to sunlight. Excessive sunlight, you and your patients need to know that yes, the sun exposure, even minimal, can cause can cause skin-related malignancies, and that should be an informed decision right there. On the other hand, dietary intake of vitamin D is important. Fish such as salmon, eggs, like egg yolks, again egg yolks rich with cholesterol, again make an informed decision for your patient. And probably the safest way is ordering or taking supplements with vitamin D, and thankfully there are so many different types of vitamin D supplements on the market, so you have lots of different things. Paget disease is a relatively rare disorder. It's also known as Osteomyelitis deformans. It's a chronic metabolic disorder and it affects bone formation. Excessive resorption of spongy bone, and it will also cause accelerated formation of softened bone. So normally bone is broken down and replaced. Osteoclasts, osteoblasts, they work together. So there's a constant rate of this that's going on, and we know that the process is called remodeling. But in Paget's disease, the overgrowth of new bone that outplaces the breakdown of old bone is different. The new bone is thicker than the old, but it's much more weaker, and which will increase the possibility of fracture. So basically you are changing the bone into something more spongy and more brittle, and at the same time the new structure is much thicker but structurally not so strong. When X-ray is done, it will reveal a mosaic bone pattern, and every radiologist would tell you that it's Paget's disease. Paget's disease will affect axial skeleton, and it will affect basically pelvis and long bones of lower extremities, and usually it occurs after age of 40, and it will become more common with advancing age. Thickened bone can cause abnormal bone shapes, and which can be cosmetic defect or functional defect, but at the same time they may result in brain compression, impairment of motor function. They may also result in deafness, atrophy of the optic nerve, and this all happens. Deafness, for example, happens because there are bones in the ears, although they are very small, and hearing will be certainly impaired. So secondary problems of the Paget disease is the development of osteosarcoma, so osteosarcomas will be more prevalent in the patient with Paget's disease. So again, the etiology of Paget's disease is rather unstudied. There are theories around there, but I'd like to say that really, truly, this is an idiopathic source. Of course, there is a source, we just don't know about it, and there are different theories, but jury is still out there. But the point is that Paget disease, like osteoporosis, can be treat it, or at least patients may benefit from it, if we introduce calcium and vitamin D supplementation. Osteomyelitis is an infection of the bone. Most common causative organism is Staphylococcus. Staphylococcus infection is most commonly, usually causing the osteomyelitis. Often when we look at it, it will come from the top, from the open wound, and we can call it exogenous osteomyelitis, but also can be blood-borne, like endogenous. But again, as any infection, will result in acute and chronic inflammation, can cause constitutional symptoms such as fever, weight loss. Patient may complain of severe pain, bone pain, and it may result without treatment in necrotic bone and basically continuing of the necrosis of the bone. So treatment is usual for the infection, which may include antibiotics, debridement, surgical removal of the affected bone, and there's a rather new treatment of hyperbaric oxygen therapy. Also, a capsule releasing antibiotics may be placed surgically into a spot where, or into a enclave where the osteomyelitis is present, which will be releasing antibiotics rather constantly over several months. So this is a severe infection, and this is very difficult to treat. So exogenous osteomyelitis is much more common and somewhat preventable, or it can occur with nosocomially, with as a consequence of manipulation of the bone for surgeries, as well as with the injections of the joints. And so again, strict sterile technique is important. Any procedure is done, but with bones it's becoming of utmost importance. So the treatment may be successful, but it's very, very long and very taxing for the patient.